Bismillahirrahmanirrahim. Thank you, Madam Chair, Prof. Habibah A. Wahab. Assalamualaikum warahmatullahi wabarakatuh, and very good afternoon to all distinguished panelists, fellow colleagues, ladies and gentlemen. First of all, on behalf of Pharmaceutical Service Program, I would like to thank the MPS and organizing committee for inviting me in this forum. This is the topics that was given to me for this forum. I think most of us have good information about these topics. Perhaps it is more on knowledge and experience sharings among us and give good overview on the importance of COVID-19 vaccination. As most of us know, that the COVID-19 names came from CO, which is stand for corona, V for virus, and D for disease. Formerly, this disease was referred to as 2019 novel coronavirus or 2019 nCoV. As you can see, there are spikes around the virus. However, the spike is very important for determination of the strain and also in the vaccine production. Since discovered in 2019 and announced as pandemic on 11 March 2020, the whole world is affected by COVID-19. As we can see in WHO COVID-19 dashboard, as of 6 July, there have been around 183.7 million confirmed cases of COVID-19, including about 4 million deaths that reported to WHO. As of 4 July, a total of 3 billion vaccine doses has been administered in globally. There are also other dashboards that keep on track on COVID-19 statistics, such as our world in data, as compared to 1st January 2021 and 4th July 2021. It is noted that the countries with high vaccination rate have decreased steadily in new confirmed COVID-19 cases, such as US and Singapore. As for Malaysia, as we know that the 20 cases per week is still high. And as we know that MOH will announce the updates on COVID-19 cases in Malaysia and Delhi, perhaps we can see the decrease after the vaccination rate become higher than 50%. Among ASEAN countries, Malaysia still have high new confirmed deaths per million, but as mentioned in the graph, the number may be not accurate. There are too many compounding factors that affect the report. Other than the non-compliance to the practicing the new norm and the ability of vaccines, the rate of the new cases were found to be associated with the ability of virus to evolve and produce other strains or variants which are more transmissible and virulent. There are two types of variants. First is variants of interest or VOI, and the second one is the variant of concerns or VOC. VOI are genome that has mutation which establish or suspected phenotypic implication and either has been identified to cause community transmission or multiple COVID-19 cases of cluster or has been detected in multiple countries or is otherwise assessed by VOI by WHO in WHO. For VOC, it is a variant that meets the definition of VOI, and through a comparative assessment, it has been demonstrated to be associated with one or more of the following criteria, such as increased transmission or changes in COVID-19 epidemiology, or it increase in virulence or change in clinical disease presentation, or it decrease the current public health and social measures effectiveness, and also it decrease in effectiveness of available diagnostic, vaccines, and therapeutics. So I think most of us still can remember during MCO 2.0, there are some concern on the strain that came from UK, which is B117, and South Africa, which is B1351. Now, instead using Pengo lineage, WHO labeled it using Greek alphabet to avoid stigmatism and easy pronunciation. Currently in MCO 3.0, we are concerned with the increased number of COVID-19 infections due to Delta variant. As an update, a few days back, there were updates by WHO on Lambda strain. However, it's still considered as VOI, and more studies needed to determine its characteristics. And for Malaysia, there is Jawatan Kuasa Kerja Surveillance Genomic JKKSG under JKJAV that monitored the genomic surveillance of the SARS-CoV that conducted by Ministry of Health, MOSTI, and Ministry of Higher Education Consortium. As there is increasing trend of VOC and VOI in Malaysia, it is our role as healthcare practitioners to inform our society on the importance of vaccination. But there are still concerns among our people whether the vaccine is beneficial or they are potentially facing risk if they take the vaccine. And as we know that each type of vaccine have their own side effects. However, as you can see in the slides, there are much more advantage of vaccination as compared to the risk. It can help to prevent the hospitalization, prevent the ICU admission, and also prevent death. This is the statistics issued by EMA after first dose of AstraZeneca vaccines. As we can see that the number of prevented cases for hospitalized, admission to ICU, and death due to COVID-19 were much more higher in the patients who are taking the vaccine as compared to blood clotting incident due to COVID-19 vaccines. The similar pattern is expected to happen in Malaysia after the vaccination program successfully conducted, as the resource of our treatment facilities such as ICU beds are limited. The information of this benefit need to be communicated effectively to our people. In normal situation, this is the pathway of vaccine registration in Malaysia. However, during pandemic, we need the vaccine in timely manner. The authorization for the use of pharmaceutical product during pandemic varies according to countries. In US, it is emergency use authorization. In UK, it is authorization of emergency supply, and in Europe, EMA call it conditional marketing approval. As for Malaysia, the COVID-19 vaccines are approved to use by either fast-track conditional registration or conditional registration by recognition of WHO emergency use listing for vaccines that under COVAX facility. It is a need to stress here that even the so-called fast-track NPRA is carefully and give their best effort to evaluate the vaccine in timely manner to ensure the quality, safety, and efficacy of vaccine to be used in Malaysia. Currently, there are 8 products or vaccines that registered for COVID-19 in Malaysia. 6 came from fast-track conditional registration and 2 from recognition under the recognition of WHO EUL under COVAX facility. And the last topic is on the regulation on the administration of vaccines in Malaysia. Under Poison Act 1952, currently there is no provision under the Act that allows the administration of poison to a patient except by a registered medical or dental practitioner for medical or dental treatment. And all licensed pharmacies that registered and measure have to abide by the Code of Ethics for Pharmacists in addition to all existing rules and regulations. Having said that, there are other pharmacists' roles in vaccination, especially in COVID-19 vaccination program. In COVID-19 immunization program, it showed that the pharmacists have important role in management of vaccines supply and logistics. In that program, we have to develop and strengthen the supply chain strategies to receive, store, distribute, and manage COVID-19 vaccines and their ancillary products. We also have to ensure the quality, efficacy, and safety of COVID-19 vaccines throughout the supply chain. We also have to distribute COVID-19 vaccine from port of entry up to the most remote vaccination sites. And we have to properly tracking and reporting of vaccine utilization. As you can see, now we have the tracking and track and tracing system whereby we can monitor in details the distribution until the usage of the vaccines. There are also pharmacists who are volunteering at PPV, and most of them give the service at Station 3, which is to give counseling to the vaccinee. And most of the pharmacists, including community pharmacists, also helps in disseminating correct information about COVID-19 vaccines. As a conclusion, pharmacists in Malaysia is also contribute significantly in COVID-19 immunization program, directly or indirectly. With that, I end my presentation. Thank you so much for your attention. Over to you, Madam Chair.